Okay, guys, we're here. One on each side.
Oh, that just wait.
You guys are the.
Yeah, two of my special people. Three of my special people.
You guys look tired.
We are.
Well, if we trade places, I think you'd. I
I'm
think I
sure
beat you.
Yeah.
Well, I'm glad we're here to see your smile first time. So, are you excited?
Yeah, I'm excited. I'm ecstatic about my top. I don't have to worry about taking it out, putting this thing. Oh Lord, it was too much. Too much.
So we did a little bit more intense surgery on you. We did zygoma and pterygoid implants. I'll show you actually on the CT here in a second. You'll get to see that. But on a scale of 1 to 10, as far as pain, 10 being the worst pain, where are you at now?
Now it's 0.
0.
I have no pain.
Did I pay you to say that?
No.
I know it really is crazy.
No, I'm just, you know what? When I was back home, I was thinking about, I was like, that was weird because, well, the first surgery, you know, because that was too much too. You have to remove all that thing. So that was there was a little bit of percentage. But this time, no, I'm not. I don't have pain other than, you know, the sinus headache from the zygoma. But other than, no, I don't have pain.
Well, that's awesome. I would expect you to be, I mean, even like I do this all the time, but zygoma seems like it should be more painful, but it really isn't. So, okay, well, let's do this. I'm going to I'm going to let you show. Which one do you want to show? Your son or your daughter? You got to pick one that gets to see your smile first.
Oh. Yeah, because he says this one.
He's not a believer. Okay, let's make him a believer.
No,
first.
he says you gotta have a nice teeth. So,
Okay, go ahead and take it off. And
Oh,
show
so
him.
it's these ones?
These are-
Ooh,
nice.
nice.
yeah, I like it.
Okay. How about the teeth? You said not too big one.
Yeah, they don't look big.
Okay.
Oh yeah, those are good.
Okay.
Yeah, they don't look big at all.
All right then.
Natural.
That's good. Yeah. Because he was like, Mom, make sure it's not big teeth.
Yeah.
So
Yeah.
It's a good size.
Awesome. Okay, do you want to see him?
yeah, I want to see my teeth.
Okay. So go ahead and take the mirror off, or actually put the mask on,
Oh,
and then you're going to go ahead and you'll stand up and look in the mirror. There's lights on the mirror.
Okay.
Oh, so this was the before?
That's the before,
Oh, dang.
and I'll show you the after in just a second.
Oh, okay.
Okay.
Ready?
I'll show it.
Oh, it's nice. But next, I can't talk right now. Hello. Well, because I'm swallowing right now, that's why, right?
Yep.
Yeah. I like it. Yeah, I don't have to take it out and all. Thank you.
Yeah, you got a denture.
I can't
before.
wait for this one to go down.
Yeah.
It'll be normal, you know. So
Yeah. Let's look at your side by sides. That was your teeth before. Okay, and we're going to show you what they look like now. Looks a little different there, doesn't it? Okay. That was your side profile before. This is swollen.
yeah.
But you notice how much more like symmetrical the two are? Before your face, your lower chin was collapsed in. And so maybe go back.
And the lip.
See
Right,
that?
yeah.
See
See, like the lip was so.
Right. Yeah.
The cool thing is once you heal up, you're going to see that this will
Different.
change. And that's why we take pictures now.
Uh-huh.
Let's show the CT. So that was your old
Before.
implants,
Uh-huh.
and this is your new ones.
Mm.
Oh wow.
That's pretty
Alright.
cool, huh?
Yeah, it's pretty cool.
So you have 4 zygoma implants, and then I threw in
Uh-huh.
some bonus ones for you.
All right.
Those
thank you.
back ones are called pterygoid, and that makes it so you have to be like a crocodile. Remember how I have to get all the way in the back?
Uh-huh.
Like you have to open so.
Uh-huh.
That's the blessing and the curse. So
For so how long
more
does
blessing.
it heal for the whole thing? For me to actually go back to normal.
So 4 months is standard
Okay.
time for the top to heal. Sometimes people will take a little bit longer just
Right.
because they're slow healers.
Uh-huh.
But I think that given that you healed pretty well in the first one,
Mhm.
I think you're going to do great. I think that so I would plan on getting you back 4.5
Okay.
months out.
No biggie.
By then the swelling will have gone down and your gums will have like stabilized, like the lower.
Uh-huh.
That's the other thing I did, right? I gave you a new set of lowers,
Mhm.
and now they're touching the gums so that you don't get food caught in there, right?
Right.
So they're a lot closer to what the finals will be, but they
Right.
don't have the extension back.
Uh-huh.
And so just know that you'll have more teeth in the final in the zirconia.
So when I clean this I can use that thread, right?
Mhm.
Underneath stuff.
Yep. On the bottom, yes. On the top, just give it a week and a half, 2 weeks before you start doing that.
Right, okay.
You can use the syringe, like the bag we gave you.
Right.
You can just kind of flush it out with that. Once once you're about 2.5 weeks out, you can start to use the water pick and put it on the lowest setting,
Mm.
and then you're gonna, just irrigate it, just like you would cleaning out, just like a power washer.
Okay,
But nice and slow. If you start to feel any pain, then you back off, and then you give it a few more days and go back to the syringe.
okay. All right then.
Okay.
So no chewing. I mean, you still have to chew a little bit with egg or something like that.
So the definition of chewing is.
Exactly.
So I'm gonna get kind of nerdy here for a second, but
Mhm.
chewing is where you bite down, your lower chin goes up and it hits, and then it slices to the side. So it's like,
Oh.
you've ever seen a cow? You've ever seen a cow chew?
Right,
It's doing
right,
this
right.
weird
So
action.
that's true.
The reason why is because their jaws, their teeth are so flat, they have to like really scissor. So I don't want you to do any scissoring.
Okay.
But if you just touch them together, and you don't go sideways, because it's the lateral movement. That's what we don't want on the implants. Okay.
Okay.
So err on the side of caution, if anything. You asked about salmon. Like I said, if it was like salmon from like a reputable restaurant that's nice and cooked the right way, I've had some pretty bad salmon. Okay, so meaning like it tastes like
Yeah, I know.
it's just kind of good.
All
I'm
right.
not proud of that either, but I had too raw, so that's even worse.
You're right. Yeah.
So I love salmon though.
So
But
nothing.
yeah, pizza,
Okay.
steak,
Oh,
chicken.
God,
Your all
no.
American diet, no. I would stick with pastas, soups, meatloaf. Right, meatloaf would be actually probably the best type of protein because it really just kind of slices easily. These teeth are also really flat.
Mhm.
And that's on purpose. Think of it like they're like kind of training wheels.
Right. Yeah. It's
With-
because
well,
it's stamped. Yeah. I
Yeah,
get
when we
that.
go to the
Yeah.
finals, then we can make them a little bit more sharp and put
Yeah.
the pits and the valleys and the
Yeah.
mountains into them. Okay.
Okay. All
So-
right. Well, thank you.
Is rice okay to eat? Like rice?
Yeah, rice be perfect.
Okay.
Good.
Um,
Good.
There's there's actually a lot of threads on Facebook. If you look for them, that people actually talk about this. I've been finding them, but
Well, I'm
people
ready
talk
to
about what to
rolling.
eat. But don't do apples. Like I see some people
Oh
right out of
God, no!
surgery
I
take an
don't
apple,
even
and
eat though.
the doctor actually gives them an apple.
Oh
I'm just
God,
like,
no! Even when I had it before, I
It's-
never do the apple. No.
Have you heard the phrase like just because you can doesn't mean you should?
Yeah, I know.
Yeah, that kind of applies there, I think.
Yeah.
But
The only thing that I'm looking forward is I like peanuts, so I'm looking forward to that. Corn nuts,
Yeah.
Filipino corn nuts, but not the American. No, our corn nuts is not the same as
not our cheap corn nuts.
no. Their
Okay.
corn nuts here are like
I didn't
hard,
know. I
hard.
didn't know this.
I can't do that. I can't do it. But I'm looking forward to those things.
It's also really normal for you to, when you get a new set of teeth, for your mouth to be dry. Just know that
I'm
there's
always
two types
dry.
of people. There's some people that salivate like crazy when I put the device in their mouth,
Yeah.
and it's like hard because they're like gushing. And there's people that typically that are just really dry. So that lip also, when it's dry, drink a lot of water.
Oh.
Um,
That's my issue. I don't drink a lot.
Good thing is that dentures not gonna be falling out. Like when we're falling out, not have to
No.
worry about with the glue.
Right? Yeah. Well, it should look a bit better once my swelling will go down.
Yeah.
You know what I mean? But I
You'll have
still
to have
thank
it on
God for
now.
this.
Okay.
I know, but I don't like my swelling. But
It's okay.
well, thank you so much.
I'm not offended that I give you a new smile and you cover it up. It's okay. 3 days of blood, sweat, and tears. Whatever. It's okay. You just cover it up.
I hate the swelling.
I'm
I
just
look like a
kidding.
baby. But
Well, but it's all gonna heal up. And
I know.
And,
thank you.
remember, I'm just give you some quick reminders. And she's my nurse, and so she's gonna make sure you're careful. But blowing your nose would be the biggest mistake. You
I
don't want to blow your
know.
nose. You're
I
gonna
know.
feel like it's stuffy. I took a CT this morning. It still has some congestion there. That's kind of what we would
Mhm.
expect to see a couple days out, but it looks good. And so just don't blow your nose. If you cough with your mouth open. It sounds obvious, but my mom's a master. She's like this kind of stuff. That creates a lot of pressure. So you want to
I
keep your mouth
know.
open.
Yeah, I know. Yeah.
If you sneeze, right? I know you
Oh,
mentioned
yeah.
you have allergies, so take the proper medications so you
Uh-huh.
don't sneeze. But if
Uh-huh.
you do, again, sneeze with your mouth open. I want
I
blue
know.
alligator,
Oh,
crocodile kind
I'm
of.
telling you,
Okay.
I've mastered that.
Okay, good. And then tonight and the next, actually one more night of keeping your head elevated is what I'd suggest.
Oh, I know.
I think you swell more than most people, and you might, 48, 72 hours is when you typically see the peak of swelling for my patients. And so I think one more night would be good, and then keep on the ibuprofen,
Yeah.
stay on the antibiotics,
Mhm.
and the steroid.
Do I still do the rinse? Like, when can I do the rinse?
So do the rinse, but you don't have to be aggressive and
Okay.
right, like
Alright,
just nice and soft.
Alright then.
And if you have sutures that get long, like they break, she can cut them out.
Oh, I want to see her.
Okay, but you can cut them out
Okay.
too. Just make sure the scissors are clean.
Yeah.
At this point, that device is literally acting like a really great Band-Aid.
Okay.
And so it's going to actually help with the swelling to kind of keep it at bay.
All right then.
So
Well,
she did swell more than average,
that's
like in
not-
surgery actually. Like towards the end when I started to suture up, I could tell that the
Yeah.
tissue was just putting the tissue back
Mhm.
together. And I think that's more genetic. There was an infection. That's the great thing is it was a really great surgery. But so you asked how long it will take for it to go down. She might have an answer for you better than me because she knows you and she knows medicine.
Yeah.
But just remember that it slowly will, the body like basically just clears itself.
Mhm.
But right now it's doing this because it's trying to heal you
Okay.
best it can.
All right
Okay,
then.
so it's not a bad thing. It's
Right,
actually,
yeah.
it's a good thing.
But thank you so much.
Okay, do you have any questions?
No, I mean,
Do you have questions?
I
Thank
will.
you for being patient.
Yeah, thanks
So
for doing the
I
work.
did like 3 different sets. Every time she gave me a different bite. And it wasn't your fault, but I think she wasn't used to that denture biting one place, so we were kind of chasing a little bit. But I'm really happy with where we ended up.
Mhm.
And I think that for a temper, I think it looks awesome. But we'll come back in 4 months, and then I'm sure you'll have.
Now, I
some
want to
feedback.
ask you something for the final. How many days I should stay here?
So there's 2 types of patients. One that has, so some patients have more time and not a lot of money, and some people have a lot of money and no time. So depending on how you are.
No,
So,
you just tell me I'm not working.
okay, well, what I'm saying is this, bear with me. If you want to come in and we take final calculations of the gums, that's on day 1. And if you want to stick around for a week, then we go right into the zirconia.
Okay.
But most of my patients are like working and stuff, and so they'll just fly in, do the quick calculations, and fly out.
All right then.
So that's like with the whole thing. Like if time is the big thing, then I would just fly in and literally it's a couple hours. Like at the
No, I
most,
mean I can be here and then stay for probably 3-4 days.
yeah. But if you can work from here, or you can,
Yeah.
if you don't mind, then we can. We say plan on a week, but oftentimes we get done sooner.
All right then.
It's kind of like what happened here, right?
Right.
Where I don't want to give it to you. I wouldn't let you see it until I was
Right,
proud of
yeah.
it, because every time I put it in my mouth, I was like, gosh, like I just wasn't happy with the outcome. Like I can share the pictures with you later on. We can laugh about it because I literally put the midline this way, and then I go back. It's over here. I'm like, Valentina, what is wrong? I keep on missing. Like, and I'm taking all these videos. I'm trying to get the right line up, but it was just tricky. What you have a nose like me, so I didn't notice this until last night. Is that your eyes are at this level, but your nose actually comes off to the right just a little bit. So I kept on I was following your nose the first time, and the second time I was following the midline of your face, and all this unconscious. So once I finally got conscious of it, then I redesigned it. And I hit the midline right. So I think the midline looked good. And look, what do you think? I think
Yeah,
the
I
midline
think I
looks
looked
good
at
to where it is.
Mhm.
But you notice it's kind of split between the 2.
Mm.
I think it was the best mask. My midline doesn't match my nose because my nose veers to the right, left, and then it's doing a fake. So
Well, thank you so much.
she wants me
And
out
I'm-
here. She's like, I'm done.
No, because I'm
Put the mask
trying.
on. She's racing to the door.
No.
Right? So- okay, give me a hug. I appreciate
I'm
you.
trying. I'm gonna feed them for a moment
You're so kind.
before they. I know.
You guys have earned it. Thank you for